Hi, my name's Janine Stockley. I'm the General Manager, Director of Nursing for Cabrini Palliative and Supportive Care Service. Palliative care is a lot more than most people actually understand. Historically, it used to be just end-of-life care, but now because people are living so much longer, sometimes in a state where they're managing quite well, but then they may have periods where they've got symptoms such as pain or nausea, and that's where we'd get involved. So it's not just end-of-life care. Because people are living longer, it means that palliative care has changed how we give care. So we might have somebody that's admitted to the palliative care unit, and then we might actually get them home with supports, and then we might not see them until they have issues with symptoms and they have to come in as an inpatient again. The main focus is improving the quality of somebody's life or the living. So that might mean getting somebody's pain under control. It might mean putting equipment in a home. If the patient the preference was to go home, we would support them by getting the whole allied health team involved. We'd start off with an assessment to see what supports are actually in the home, and then we would go from there. It's a very personalised, and each case is different. There may be patients that have got a really large family that are very sort of capable, but often we'll actually see elderly patients that might just have an elderly spouse, so they need a lot more support in the home. We use our team here, which is multidisciplinary. Most people that are wanting to go home, we would get an occupational therapist in the home, but then there is the nursing care as well. Part of our service is that Cabrini nurses, specialist nurses, will go in and monitor patients in their home. Palliative care patients can change quite quickly depending on the condition that they've actually got, but things can change. So that's a 24/7 service. But a lot of people actually do need help with personal care, and that's where Prestige comes in. So the benefits of palliative care, it's respecting patient wishes, it's enabling patients to do what they want to do. If patients will have different goals. Some might want to get well enough to attend a wedding. Some might want to get well enough to actually drive a car. So palliative care can help when people are sort of been restricted by pain or been restricted by nausea. So we get their symptoms under control, so the physical side of things under control, often with medications, but that does enable them to live as best they can. So the key to dispelling the myth that palliative care is just associated with end of life is education. Cabrini Palliative Care, nurses, medical staff, everybody uses any opportunity that they can to educate people that it is more than end-of-life care. We do end-of-life care and we do it well. However, we also see a lot more patients for symptom management. In fact, in the palliative care unit, more people get discharged home with support than do pass away. Cabrini Palliative Care Service does partner with external services. Our preferred provider is Prestige In-Home Care. Prestige In-Home Care can provide personal care. They can also support families with domestic chores. That frees up more time for the families to actually spend with their loved one.